How to prevent foot blisters. All it takes to keep your feet happy and pain-free are a few precautions. You will need well-fitting shoes, heel lifts, insoles, antiperspirant, nylon socks, and anti-blister lotion or stick. Optional, moleskin. Step 1. Understand what causes blisters. Your body protects the skin from continuous rubbing by forming a protective pool of liquid to cushion tissue. Prevent friction and you prevent blisters. Step 2. Wear properly fitting shoes that don't rub or pinch. You should be able to wriggle your toes comfortably and your heels should fit securely. Avoid shoes made of non-breathable material like plastic. They cause sweating because they don't let your feet breathe. And beware of inside seams that may cause rubbing. Break in new shoes by wearing them for 30-minute increments for the first few days. Step 3. If you're prone to heel blisters, put heel lifts in your shoes. Wear them in both shoes even if just one heel is sensitive. Insoles also can reduce blisters on heels as well as on other parts of the foot. Step 4. Use antiperspirant on your feet. Preventing foot sweat reduces the friction that can cause blisters. Apply daily to clean, dry feet, making sure you cover the entire foot, including between the toes. If irritation develops, use it every other day instead. Step 5. If you're playing sports or working out, wear nylon or nylon cotton blend socks and avoid 100% cotton. Nylon causes the least blistering on sweaty feet, while cotton causes the most. Make sure socks fit well and stop wearing them when they lose their shape. Step 6. If you're wearing sandals, apply an anti-blister foot lotion or stick to your entire foot. The lubricants protect your skin from friction. For added protection, put a piece of moleskin on blister-prone areas. Did you know? As people age, their feet flatten, making them grow about half a size every 10 years after age 40.
Shoe rubbing you the wrong way?
Quick tips.
Put a thick layer of lip balm on the part that's irritating your foot. It creates a barrier to prevent a blister. Relief.
How to cure nail fungus. Are you embarrassed to go barefoot or without nail polish? You can eradicate nail fungus using this straight and easy-to-follow advice. You will need dietary modifications, nail clippers, apple cider vinegar, hydrogen peroxide, tea tree oil, probiotics, and olive leaf oil. Optional, clean cotton socks, laser therapy, and prescription medication. Step 1. Eliminate or greatly reduce refined carbohydrates, dairy products, and sugar from your diet. They only feed fungus. Step 2. Trim yellow fungal growth with clippers and soak your feet or fingers daily for 15 to 20 minutes in 2 parts warm water with 1 part apple cider vinegar. Continue this for 12 weeks. Step 3. Apply a 3% topical solution of hydrogen peroxide with water several times a day for several months to combat fungal spores in nail beds. Always keep your feet and hands dry, especially after eliminating the infection. Wearing cotton socks allows feet to breathe. Step 4. Treat nail fungus with undiluted tea tree oil drops 2 to 3 times daily for 6 months. Even missing 1 day may result in fungus regeneration. Step 5. Eat probiotics, good bacteria like yogurt and kefir, to combat fungus. Homeopathic practitioners also recommend herbal extracts such as olive leaf oil for their antifungal agents. Ask your doctor about laser therapy. Treatments are expensive but can be successful. Step 6. Use topical or prescribed oral medications if the homeopathic treatments fail. Did you know? Toenail fungus affects nearly half of Americans over the age of 60.
How to treat nail discoloration. Dark nail polish can stain nails a dull yellow. Return nails to a healthy hue using these tips. You will need lemon juice, water, a lemon slice, baking soda, a nail buffer, denture cleaner, hydrogen peroxide, gloves, and patience. Step 1. Add a tablespoon of lemon juice to a bowl of water. Soak your fingernails and toenails in a mixture, then rinse. Or rub a lemon slice directly onto your nails. Step 2. Combine 1 tablespoon of lemon juice with 1 tablespoon of baking soda. Apply the paste with a nail buffer, then rinse. Step 3. Dissolve denture cleaner in water per package directions and soak your fingernails for 15 minutes, then rinse. Step 4. Mix 3 tablespoons of baking soda and 1 tablespoon of 3% hydrogen peroxide and put the paste on your nails, then rinse. Step 5. Let your nails grow out without using polish. In 4 to 6 months, the stains will have grown out. If you need to color your nails, use a base coat and avoid nail polish and polish removers that contain formaldehyde. Step 6. Wear gloves when working with chemicals. Medical professionals, hairstylists, and others should wear gloves to protect their nails as well as their health. Did you know? Nail polish is believed to have originated in China in 3000 BCE.
How to treat and prevent ingrown toenails. Ingrown toenails happen when the nails on your toes grow in the wrong direction and dig into the surrounding skin. Follow a few easy steps to treat this painful condition and prevent it from happening again. You will need well-fitting shoes, a nail trimmer, a nail file, soap, lotion, baby oil, and antibiotic cream. Step 1. Make sure you have room to wiggle all of your toes when wearing shoes. Squeezing into a tight pair can set you up for ingrown toenails and severe foot pain. Step 2. Always clip your toenails straight across and lightly around the edges with a nail file. Step 3. Wash your feet thoroughly each day to keep the area clean and reduce your risk of infection. Scrub all of your toes and moisturize your feet afterward to keep skin healthy and strong. A shower rinse or bath soak doesn't count. Actively scrub your feet to get rid of bacteria. Step 4. If you have an ingrown nail, wash your feet thoroughly. Then, apply baby oil to the area to soften the skin. This will reduce pressure when you wear shoes. Step 5. Avoid giving yourself a pedicure or getting a pedicure at the spa so that your toes can heal. Pedicure tools can aggravate the skin and cut into sore or weak skin around the toenail. Step 6. Apply a generous amount of antibiotic cream around the ingrown at least twice per day to reduce the risk of infection. Did you know? People with diabetes or poor circulation have a higher risk of complications from ingrown toenails.
How to prevent athlete's foot. There's fungus among us, and it's not just around athletes. Here's how to prevent one of the most common skin problems. You will need rubber sandals, a towel, foot drying powder, breathable socks, and leather or cotton canvas shoes. Optional, an extra pair of sneakers. Step 1. When using a public shower, wear rubber or plastic sandals while showering, not just walking to and from it. Gym and pool showers are some of the most fungus-friendly places. Step 2. Dry your feet thoroughly anytime they get wet, whether it's from a bath, swim, or sprint through your neighbor's sprinkler, and make sure to get between your toes, a known trouble area. Step 3. After you dry off, put on shoes made from natural materials like leather or cotton canvas to allow your feet to breathe. Step 4. Use an antifungal drying powder directly on your feet after you dry off. You can also sprinkle some powder into your shoes to further help keep your feet dry. Step 5. Wear 100% cotton socks. Cotton tends to be more absorbent than synthetic fabrics, which will keep your feet dry. New lightweight wool socks are also great for preventing athlete's foot. The fabric actually dries faster than cotton and wicks away sweat and moisture. Step 6. Change your shoes frequently to let them air out. If possible, purchase 2 pairs of sneakers so you can alternate each time you exercise and sweat. Did you know? Roughly 70% of people in the US have battled athlete's foot at one time or another.